I'm Len May, and I'm the CEO co-founder of Endocanna Health. We're an endocannabinoid genomics company, and I have the distinct pleasure of having Dr. Chris Spooner join me, who's a naturopathic specialist, and we're going to discuss this topic and many others. Tune in. Thanks.
Yes, combustibles are bad for your lungs. Comparatively, you're consuming cannabis in a joint or a bowl compared to smoking cigarettes or other. What's the difference of in terms of your risk factor involved in combustibles of cannabis versus some of the other things I mentioned?
Oh, geez, Len, I don't have that sort of comparison right off the top of my head, so I couldn't tell you exactly. When I took a look at this, basically what we were seeing was that, tobacco's worse. Nicotine in particular is probably the worst component of sort of that impact on the lung function. Okay. So definitely tobacco is worse. Is it 10 times, 1 times, 1.5 times? I couldn't tell you. Okay. Cannabis is better, but again, the same thing that starts to come down to it is it's the combustion products that start to impair some of this. So how frequently are you using? How much are you using? These types of stuff. Cigarettes have a lot of other stuff in them as well too. If you take a look at the anatomy of a cigarette, they put stuff that slows down the burn time of the paper. There's other different things that get picked up by the tobacco plant. It's a big accumulator of things like cadmium and stuff like that. So there's all these other things that come into it that create those problems. So, and those may or may not be relevant to, cannabis products. But if you're taking dried flower, putting it in a rolling it in your own paper and things like that, using something like maybe an organic paper, as opposed to something that may have some of these other bleaches or other compounds in it, then there's no doubt that is going to be marginally better. But don't kid yourself. You're still smoking something and it's still impacting your lung function, and that's just the reality of it.
So going back to mental health, we're obviously in an unprecedented time. I really can't even compare this to anything else. I was on the East Coast by New York during 9/11. That's the only kind of reference point that I can have, but I'm not even sure that this impact may be way greater in different ways. So people are really, really going through some mental health challenges. Are you seeing an increase in anxiety among your patients at this time?
We're up here in Canada. Nobody gets stressed out about anything up here. Just kidding, Len. This is a really unknown territory for a lot of people. I think that if there was a sort of a societal picture in the way that we work and how we balance life and work and our social connectedness, I can't think of a time where we've been stretched thinner, working harder, have less work-life balance. And this virus is hitting at a time where stress and anxiety, those definitely impact immune function. It drops it down. It makes you more vulnerable to a lot of different types of things. So the stress management part of it becomes super, super important. Now, if you're going to use cannabis to help manage that, fantastic. If that works for you and it helps you settle that down, then I think that you have to kind of balance. Okay, what's your risk of the infection? Are you dealing with the infection? What's the risk of the stress and the impact of you overall? And this goes to that epigenetic stuff, right? The hard part of this is that the sexy part of medicine, like medicines and surgeries and interventions, the ER room, that's great and it's really helpful when you're in an emergency situation. But chronic illness and chronic disease, what we know is lifestyle, diet, proper nutrition, getting proper sleep, your stress management, all those things at the end of the day make up such a significant amount, like, maybe 80, 90%, of your healthcare issues and your chronic healthcare issues can be impacted by those things and specifically. So, and stress management is part of that because it ties into all the rest of those things. Are you getting out for your exercise? Are you getting fresh air? Are you getting proper sleep? So again, if cannabis can certainly fill that role, and if there's anything, that I would say, it's like, hey, if you find cannabis helps relax you, if that helps impact and manage your stress levels, then don't get complacent. Make sure you're doing all these other things that the CDCs are telling us. Avoid crowded places. Make sure you're protected yourself. Do all that stuff about, the social distancing. Try and really limit the infection and the spread of the infection. And so then that way, all this other stuff, then continue to use cannabis to help manage these other things as well.
Hey everyone, I hope you found this information super helpful. Please don't forget to subscribe below right here and stay tuned for all the latest and greatest from Endocannabinoid and what we have to say about your endocannabinoid system and DNA. Because remember, cannabis is personal. Stay healthy, stay well. Thank you.